Hi, my name is Jeffrey Newman. I'm a cardiac surgeon associated with Tenet Florida Physician Services. I'm here talking about minimally invasive cardiac surgery, including aortic and mitral valve surgery. Traditionally, we've done sternotomies for adult aortic and mitral valve surgery. Now we can enter the chest using a 3-inch incision, either right next to the sternum or on the side of the chest wall, depending on which valve we are approaching. The sternotomy is an incision where we go through the center of the breastplate that we use with traditional open heart surgery. It allows us to access all areas of the heart, but sometimes when we're just operating on either the mitral or the aortic valve, we don't need access to the entire heart, and we can limit the incision just to get to the valve that we're working on. Most surgeons traditionally do a sternotomy, as that's what we were trained to do, and it tends to be more familiar. Now, as time has gone on, we've realized that we can do the same operation through smaller incisions, which offers the patient less pain at the end of the operation, as well as a more cosmetically appealing incision. The benefits of minimally invasive or small incision surgery are that cosmetically, the patient has a smaller incision. The process of the operation offers the patient less pain, less potential for bleeding, and direct access to each of the valves that we're operating on. In general, when we're approaching the aortic valve, the incision is next to the sternum, about 3 inches in length. If we're operating on the mitral valve, we tend to go on the side of the chest, sort of next to the breast, if you will. And again, more cosmetically appealing to some patients who might be in their 40s or 50s that are undergoing heart surgery. Anybody that's undergoing mitral or aortic valve surgery in isolation, meaning they need the aortic valve replaced or the mitral valve operated on, meaning repaired or replaced, as long as you don't need another procedure during the main operation, meaning bypasses at the same time, or for that matter, a double valve replacement, because the incisions change as we have to rotate around the heart to get to the different valves. I think we're going to continue to use minimally invasive surgery. There is a branch of heart surgery called structural heart, which is a combination of interventional cardiologists as well as cardiac surgeons that are having literally no incisions and following the body's own railroad track or normal vasculature to get to the different areas of the heart. That's becoming more and more common as people need isolated aortic valve and mitral valve procedures. Those procedures, though, are truly minimally invasive without requiring any surgery, are really left for patients that are too high risk for any kind of open heart procedure.